Welcome back to PHAMCAST and this really exciting new series we're kicking off, Massage Therapy Beyond the Table. Really passionate about this, and we've had two segments with Leanne Monaghan, a fellow massage therapist who I admire, that I do a lot of work with, who's a PHAMbassador, and we're talking behind the scenes of how we're going to blow that up even more in year 4 of Preventative Health Month in February 2026. And our discussion has been just so inspiring, and I hope is going to be inspiring for the viewers and for the massage therapists at home as well. So this next, segment, I really want to dive into what I love to call the ripple effect. The ripple effect that massage therapy has not only on the people we have the privilege of treating, but on the professions we have the privilege of referring to and collaborating with, on the government officials that are now learning about the role that massage therapy can have, the media that's paying attention, and to communities that as massage therapists we know as veteran massage therapists, we've built our practices on doing community work. And on being servant leaders, so that we could talk about not what we do for a living, but our passion and our leadership for what we have the privilege of doing from that mindset. So let's talk a little bit about empowerment, leadership, and this ripple effect. I know, as I was a government board examiner for massage therapy for several years when I first graduated and opened my practice at Wallis for Wellness, and it was a privilege, to be helping to create the future of massage therapy. Doing the board exams, this was the ultimate test for massage therapists to get their license and to be able to practice. And I took that very, very seriously for several years, and I still do. Here's what I knew had to happen, and this was especially true 33 years ago. We had a lot of work to do to make sure that our profession was seen in the light that I knew it deserved to be seen in, as a profession, a regulated health professional, and as a pivotal point that launches all other healthcare, as well as helping everyday people be the CEO of their health. We're in a different place now, but here's what I know still to be true, and I'm speaking to all you massage therapists out there. There's this fear. We have a college, and I'm thrilled we have the College of Massage Therapists that governs and makes sure that we're doing what we should be doing in protecting the public. We also have the RMTAO, our professional association, that I have proudly and happily paid into every single year since the day I graduated, so we can have a collective voice. But there's this underlying simmering fear sometimes massage therapists have about, we have to stay in our lane. And don't get me wrong, we have a scope of practice. I know our scope of practice, and I practice within it. But that doesn't mean that you can't lean in, learn, and grow. And when I say push the envelope, it doesn't mean breaking rules, but it does mean being boldly confident in what you do know, to tell others, whether it be the doctor, the surgeon, the media person, the government official that I've sat on, or the committees that I've sat on over the years, to let them know what we do, how we do it, and why we matter. That fear has to dissipate so this ripple effect can become a tsunami. And that's what PHAM is doing. Leanne, you know firsthand that fear of, oh my gosh, I've got to make sure I'm just a massage therapist. We're not just a massage therapist. We're proudly a massage therapist with all kinds of skills, and we know where we fit. But you've managed to find a way to connect with others, whether it be community. Let's talk about that from the lens of the first having fear, and then how you leaned in and what that's done for your profession, your personal business, but also for our profession.
Love that question. And we spoke about this before the camera rolled. Whenever you talked about, we have this fear when we first are certified, and I know that was very real for me in the first infancy stage of my practice. I was afraid to speak, and this was knowledge that was true, that was tried and tested, but I didn't feel that I could speak that to my clients because I was just fearful, because I thought, oh my gosh, my license is going to be ripped away. So that really shaped me in the beginning. And then as I started to evolve and get my confidence, and not that I wasn't confident as a massage therapist, but for my voice.
But in the early days, we have to, confidence is a muscle. You have to build that. You have to take courses. You have to spend hours in a treatment room honing your clinical skills and asking questions and being curious. So, you know, that's recognizing that you don't have it all figured out is important, and really understanding your scope of practice is an important part.
Yes, truly it is. So then as I evolved in that, in my practice and even in my own personal journey, because what happens on the inside for me, it's happening on the outside for everybody else.
Yeah.
Right? Like I always say, it's an inside job. And then I began to be more comfortable speaking about different aspects to clients or to other people, because I checked in with my intention. Like, it's to serve. It's to help you. It's to empower you to become the CEO of your own health, and maybe look at it this way instead of this way. Again, mindset too comes into it.
Yes.
And then I was able to really dig in and lean in and have the confidence and speak out to other healthcare professionals or other RMTs, whatever that looked like. And then it evolved into, I can have a greater impact rather than just one-on-one on the table.
Yes.
Right? And then that's when, if you're thinking about this from a business model, a marketing model, but also from service, I mean, it's all
has
there.
To come from
it has
service
to come
first.
from service first. All these layers. And that's when I had the idea, I did that in Acton for 16 years, yoga in the park.
Yes.
It was a free event where everybody could come, and it was by donation. And in the beginning, it was for the Upper Credit Humane Society, because animals are very near and dear to my heart. And then it was for the backpack program, Links to Care. I mean, imagine kids going back to school and they don't have
they don't have the food and the things they need.
Anyway, yes, thank you for that. And so then that's when I did yoga in the park. So I mean, I had sometimes 80 people at these events that, and again, educating them, and it's coming from service. And then that has a ripple effect. Then business-wise, you get known.
Yes.
It doesn't mean that it's going to happen right there on the spot.
Bingo. Oh, let's stop and hold on that. And this is so important because, I'm also a business mentorship coach in the field of not just massage therapy, but often healthcare professionals, because we think as healthcare professionals first, which is a wonderful place. We want to give. We don't think like business people, and you cannot run a practice without thinking like a business person. But if you do it from a place of service first, and you don't expect an instant result, well, I didn't get a referral into my clinic when I did that, I'm not doing that again. It's short-sighted. And that's where, where resilience and where foundation building leads to long-term sustainable success in business, but also in the way it makes you feel as a clinician. You're now becoming a trusted resource in your community. You are a thriving example of that. And and bravo for doing that. So yoga was something you were trained in, you liked doing.
Yep.
And that all of a sudden, though, people were showing up in your clinic.
Yes.
At some point.
At some point. It didn't mean that there's the class and they ran right over to the gym and signed up. A few did, but that wasn't the goal.
Right, exactly.
It wasn't the goal. It was service first.
Yes.
And I knew, because you think about universal laws that are applying for you and applying for me, cause and effect. Yep. And it's just the law of gestation, and that meaning the time that it's going to take for that return of your cause and effect, right? And then I did
and the consistency of that, because here's the other
huge.
thing that I want to point out from from the idea, whether it's with your health and getting health outcomes, or whether it's with your business as a massage therapist, you can't do something once and expect the ROI, the return on investment, to be huge. It's consistency. It's failing forward and often and doing it again and tweaking it and being willing to look at and say, well, what could I have done differently? What was good about that or not good about that? It's not do it once, put one Facebook ad out, or do one yoga in the park. You just said you did yoga in the park for 16 years.
16 years, yes.
Right. I remember for years doing an annual Christmas event where we, for a day, all the practitioners in my clinic came in on a Sunday. We'd have, a live band in the waiting room and food, and we'd work for free. We'd reduce our fees, and whether they're coming for a massage, a chiropractic treatment, a physio, whatever it would be, and we would donate that, and then we'd host a party, give the money to the hospital, and host a party this was before COVID, where we could go into the hospitals,
yes,
in the wards for children, and host a Christmas party. And we'd raise money and donate, and patients looked for it. Was called Warm Hands, Warming Hearts. We did it for years. The return on that, both from a impact on business, but from a building credibility and awareness of what we do as massage therapists or a collective team at Wallis for Wellness, but more importantly, the impact it has on the health of humans.
Right.
And I think we've got to remember that, and as massage therapists, we can really do that. So that, but it took, you did that for 16 years.
Yes, and if I could just say something, because what you said inspired something in me that I definitely think about. It's the psychic income that you receive from doing these events.
Yes.
Right?
Yes. Yes.
Psychic income is real.
I call it the currency of impact, which is
yeah.
the same thing.
It is, yeah.
There's currency. We have to pay our bills. That, without a doubt, that is the reality, and we need to be compensated and properly for what we do, without question. But then there's this other currency, and that's the currency of impact. And what people don't realize, when we live with that mindset, that currency of impact returns tenfold or more, both from a mental, physical, emotional, and financial way.
Absolutely.
And spiritual way. Mm-hmm. Because that is what your intention was. And that currency of impact often gets forgotten, and it, to me, is the key secret ingredient
in success, and abundance, and having a thriving
whether
practice.
It's in your health, whether it's in your
Absolutely.
business, whether
Yep.
it's in your relationships. The currency of impact, you don't just do something to get something. You do something. My father, rest his soul, an amazing entrepreneur, and my mother, they led by example. They always said, fail forward and often, but do something with a servant heart, and do it without looking for a response. Do it because you want to, not because someone's looking. And if you have to think twice about it, don't do it. Mm-hmm. Because if you're coming from that lens, I'm going to do this because I'm going to get this, all of a sudden, we talked about energy in the second segment, that completely shifts the energy of what you just put out. And I know that's the way you believe, and I know that's what you coach in what you're doing. Let's talk a little bit about the ripple effect in corporations and how massage therapists can play a role. I've done extensive corporate wellness programs with as a massage therapist, lunch and learns, full day events, half day events, collaborative events where wellness bell ringers, where I'm bringing all kinds of healthcare professionals together, keynote speaking engagements.
Right.
It's really important that we remember as massage therapists, as you just said, to not be fearful. Yes, do what we do in our treatment room, but then reach beyond our treatment room walls, looking for those opportunities of the currency of impact, and finding ways to take our genius, our storytelling, our knowledge, our clinical experience, to share it with others.
Yes.
That has been what's been very successful in my corporate wellness programs, because it's relatable, it's real, it's tangible, and it's impactful in the bottom line of corporations when we're talking about musculoskeletal health, which is one of the big things that cost corporations immensely. Mental health, which we're also, as massage therapists, really play an important role in managing.
Yes.
Bone health and musculoskeletal health are big. We're now taking REMS bone scans and education into corporations. Talk about corporate wellness from that lens.
Again, we're preventative.
Yes.
Right? Our profession is preventative, and of course what you just said about going beyond the walls and the boundaries of massage therapy, because we both have extensive courses that we've taken that take us beyond the walls of RMT, but it enhances. So when we bring this awareness into corporate settings, it helps their bottom line.
Yes, indeed.
It helps their bottom line. I remember going and doing a corporate wellness talk, and the first thing I said is, do you know your benefit package?
Yeah.
And most of them don't know their benefit package.
Right.
And I'm like, that's where your team is built. Like, let's look at that. Like, what pools do you have? Chiropractor, massage therapy, naturopath, acupuncture. Like, where can all of these different modalities fit into your care so that you can work better, so that you're not taking the sick days, that you are mentally healthy?
That you have presenteeism, not
Yes.
just absenteeism, because people could
Exactly.
be at work but not present because they're not well. And yes, that
Exactly.
preventative lens is critical.
Now, I wanted, so there's a second part to that story. Now, management was in there when I'm talking about this, and they're like, oh no, like, she's going to cost us money because now all these people are going to tap into their benefits. And I that blew my mind whenever they pulled me aside afterwards. And I'm like, do you not see how this is going to positively impact your bottom
And there are
line?
statistics, real statistics.
Yes.
And I understand
Yeah.
organizations and bottom line matters, but it is, and that's what this movement is about and why I started it, is really looking at reactionary care and what the costs to the system and to corporations. It's significant. But then for every dollar spent, and this is old stats and we need more updated ones, for every dollar spent, there's like an $8 return on investment for those wellness programs.
Yes.
But it's getting that mindset that yes, and the other role that I'm playing as a massage therapist, and I know you lobby in this way too, is having conversations. I've presented at insurance companies and talking about how do we create packages so that the insurance company also benefits. When we can prevent major diseases like cardiovascular disease, depression and anxiety, mental health, hormonal health, all the things through preventative lens, we save money in the treatment, the surgeries, the hospitalizations
Yes.
that also cost the insurance company in a big, big way, let alone the cost and impact on people's health, well-being, and strain on our healthcare system when we have an overwhelming sick population. It is about mindset and why these conversations are so important and boldly having, but once again, back to your point, how do we have the ripple effect? Education. We have to educate government officials, insurance companies, other practitioners, change makers and policymakers. I am proud, beyond proud, that I am one of 3 allied health professionals as a massage therapist on the curriculum advisory board for the Toronto Metropolitan School of Medicine. I want to give them a shout out because this new School of Medicine is the first of its kind. It is going to graduate future doctors, not only trained in traditional medicine like they've always been, but also recognizing the importance of the curriculum that speaks to preventative and integrative medicine so that the future doctors will have a better understanding of the whole person and the role that all of us integrative people have, or professionals have. I've earned a spot at that table next to researchers and professors and doctors and surgeons. It brought me to tear, and I'm boldly here to say we're better together. And here's what the university knew. That's why I was invited to the table, because what we do and what the experience we have a lot to offer. And I'm boldly stating that. And for all you massage therapists, this is your call to action, because you can do this too. You can join the preventative health movement, join the family, PHAMILY.
Yeah.
It is really incumbent upon us. We all have to be part of the solution. You know, mindset, back to this, you know, massage therapy in the early days, what was most people, if you'd say, okay, massage therapy costs whatever dollars per treatment. The first thing they would say, does OHIP cover it?
Yes.
Right?
First words out of their mouth.
Right?
Yeah.
And I get it.
Yeah.
Costs money. There
Yeah.
people, you know, they want to be on with the OHIP system, which we're grateful for. But it's all about where we put our investment. And if your health isn't worth investing in, but now years later, because we've lobbied, there's a lot of insurance companies now that cover massage therapy, as you alluded to.
Yes.
Which is amazing. But then bringing new technologies like the Osteosound REMS bone scan to Canada recently, and saying to every person that had a scan, please submit this to your insurance. And they'd say, oh, they're not going to cover it. And then I would look at them with an empowering look and say, do you want to be part of the problem or the solution? Because how will an insurance company know that this Health Canada approved device is here and the benefit of it if we don't put it under their nose? And over time, just like you said, it doesn't happen overnight, but over time, they'll eventually ask. And when they are, I'll be ready with the research, the information. Well, as you know, Leanne, because as a FAMCAST, Staying Alive Fitness has opened and collaborated with us in Osteosound to
Yes.
bring the REMS bone scan to your clinic several times, the education. So you see the value in it. But now we've had 3 different insurance companies reach out and say, what is this REMS bone scan? And I had the research ready and the information ready to send. And now people are getting it covered. Don't tell me that the average everyday person, the massage therapist, that we can't change the legacy of healthcare. We can if we link arms and collaborate and do it together.
Absolutely.
You've seen that change in your profession, in your professional journey, have you not?
Yes, absolutely.
It's incredible to see. So bravo for being bold enough in a corporation to say, because I've done it too and had that bristling at the back of the room, but it takes us explaining to them and showing them the statistics about return on investment when we look at prevention, and how health span versus lifespan is the way we need to look at. And it's going to take less burden off the healthcare system. And at the end of the day, don't we want people thriving, not just surviving? And that is what massage therapists have always believed.
Yes, absolutely.
And so, you know, we're coming to the end of, you're going to have to come back.
Thank you.
But let's just sort of, you know, summarize. If you were to say a call to action to massage therapists, from a veteran massage therapist, from being a FAMCAST and this preventative health movement, what do you want others to know, as well as, you know, your clients out there, your future clients? What do you want them to know about what we do?
I believe that we need to firstly embody what we teach, right? Whenever we walk into a room, we have a beautiful skill set of professionalism that a lot of people don't have.
Yeah.
We show, without saying it in words, self-care. And people notice that. And so for massage therapists, 3 things that I would say to them would be, take care of yourself first.
Yes.
Take care of yourself first. Do the things. Rest when you need to. Nourish your body. Get outside and walk. It doesn't mean you have to be in a gym, but
ask for help.
Ask for help, right? Ask for help. Then number 2, as I said at the beginning, practice what you preach.
Yes.
Practice what you preach. Be that role model. And the thirdly, what I would say is being, and you said it so beautifully at the beginning, being open and vulnerable about your own journey.
Yes.
And then that way you're more relatable, and actually you are more inspirational to others.
You bet.
So those would be the 3 recommendations, and that's across the table.
Yeah.
I would say it doesn't have to be just for RMTs, but it's a way of life.
It is.
For me, that's what it's morphed into from the beginning day of, like, oh, maybe I will be a massage therapist, and hadn't even had a massage before.
Yep.
That journey from there until sitting here with you. And yes, so thank you for that, Margaret. Thank you for what you do.
Well, thank you, and we're better together, and I'm not doing this alone. It's never my intent to do this alone. This preventative health movement, you know, was an idea. Someone needed to take the lead, and I did that, and it's been humbling to watch the last 4 years how it's evolved and more. Be careful what you wish for, because it's now a beast, and which is a wonderful beast, and it's going to continue to grow. If you're a massage therapist out there, join our family. If you're a corporation, reach out. Make sure you're following famhub.ca on Instagram. Make sure you're going to Preventative Health Awareness Movement on YouTube and subscribing. Watch on TV Kojiko this incredible show. We're on Spotify, we're on YouTube and iTunes. Together, we can change the legacy of healthcare, all of us. And thank you, Leanne, for kicking off this special series that's going to evolve, and you're going to have to come back in other roles. Thank you for being a FAMCAST and a leader. And you know, what I love about these conversations is that I always learn from those that I have sitting at these tables for these conversations, and I want to thank you for that.
Oh, you're welcome. And that's what I really love about the 2 of us, is that we are eternal students.
Yes.
And we're open, and yes.
Yeah.
Yeah. So
Well, what a
thank you.
great show. Stay tuned, and remember, a healthy tomorrow begins with prevention today, and that's what FAMCAST is here to do, to help stock your preventative health toolbox. Until next time, everyone, stay well.